The International Federation of Red Cross and Red Crescent Societies is deploying a treatment centre to provide urgent care for hundreds of people in Madagascar. This is after a plague epidemic killed 57 people and cases of the highly infectious disease doubling to a total of 561 cases over the last week. Susan Mwongeli reports.
The World Health Organization says 561 cases have been reported so far. Red Cross officials have said the situation is particularly worrying because pneumonic plague has occurred for the first time in non-endemic areas and crowded cities.
Over 3/4 of the cases reported are the pneumonic type, so the transmission of which is from one person to the next through coughing, through respiratory transmission.
The outbreak was reported in late August following the death of a 31-year-old man in the Central Highlands where the plague is endemic. Since then, the situation has considerably worsened due to the lack of immediate care in some parts of the country.
We've seen a doubling in cases over the last week. Some of that rise in cases will be due to the reporting system having been strengthened. And of course, not all the cases reported are indeed confirmed. However, what we are seeing, though, is a very concerning upward trend in terms of numbers of cases.
In Madagascar, cases of bubonic plague, a disease spread between animals to humans through flea bites, occur nearly every year. However, the emergence of the more virulent pneumonic form of plague has raised serious concerns because of its rapid spread into urban areas.
So far, we have luckily not seen anything of resistance, but that is of course why we're heavily advising against self-medication. People are stacking up with antibiotics, which in general is not a bad thing to have them ready if needed, but again on the advice of a healthcare provider and on the advice of a doctor. So just taking antibiotics for the sake of it would not help and actually would heavily increase the risk of microbial resistance.
Despite growing concerns over the extremely contagious nature of the pneumonic strain of plague, no travel restrictions are in place at this time. WHO and IFRC have been working with Madagascar authorities to scale up efforts to provide critical treatment to those showing symptoms and to educate the public at large on early interventions and warning signs. Susan Mwongeli, CGTN.
Well, to get more information on the Madagascar plague outbreak and efforts being made, we earlier spoke to WHO spokesperson Christian Lindmeier.
The situation is concerning, simply because it's different than in all the recent years. I mean, for once, let's start with that Madagascar has or does see plague every year. So the plague is endemic in Madagascar, and normally they get about 400 cases each year of mainly bubonic plague, which is the form transmitted by the infected fleas, mainly hosted on the rats or other small mammals. This is what they have normally, and 400 spread over the year, mainly in the highland areas between September and April. Now this year, it started early in August already, and many of these bubonic plague cases turned into pneumonic, which affects the lungs. And the big difference here, the big risk, is that the lung infection spreads from human to human. So now we're dealing with a plague form which is fairly easily transmittable from human to human, and hence it is a big risk factor for large settlements. And the big city of Antananarivo and Toamasina, a coastal town, are the main infected ones. We have now over 560 cases in total, out of which alone more than 400 are pneumonic. That is what is our biggest concern right now. We have to go interrupt the spread. On top of it, sensitize the population so that they know what the risk factors are, they know how to prevent getting infected, and they know how to treat themselves. Because one thing is good, plague is a treatable and also preventable disease. We have a team of experts, epidemiologists, specialists on plague on the ground since weeks now already. We also have people who deal with risk communication to work with the population, to work with the Ministry of Health to get the right messages across. Because in dealing with this outbreak, the contact with the population is important. The population, the people need to know how to deal with it. The plague lives in the population, so the people are the ones who can stop it. But of course, as we know from other outbreaks, especially Ebola, it is very important for people being sensitized and being listened to. If you deal with a loved one who is sick or even has died, the traditions have to be able to carry it out. Otherwise, it is not possible to convince people to let go and to let go of the body of a loved one.